Welcome to Risk Matters, our latest series of podcasts created specially for dental practitioners here in Australia. As the name suggests, Risk Matters is all about managing risk. In this podcast series, we'll be taking your feedback and queries and putting them to leading industry experts, getting them to answer the difficult questions about managing risk and working safely. It's about what to do when managing risk matters most. In this edition, we're going to be chatting to Dr. Jacinta Vu about trauma-informed dental care and Healing Smiles, a unique WA charity providing dental services for survivors of domestic violence. So hi, Jacinta, and thank you so much for joining me this afternoon after I think you've probably had a busy day in practice.
Yes, thanks, Colm. It has been a busy day, but it's nice to be here and chatting with you.
Yes, no, we really appreciate you giving up your time this evening. And for those of you who don't know Jacinta, I'm just going to start by reading your bio. Dr. Jacinta is an experienced oral medicine specialist and co-owner of the Centre for Oral Medicine and Facial Pain here in Western Australia. In addition to her private practice, she serves as a consultant oral medicine specialist at Perth's Children's Hospital and is an honorary research fellow at the University of Western Australia. Jacinta holds both member and fellow status with the Royal Australasian College of Dentists and is an examiner for a fellowship in general dental practice. Driven by a profound commitment to community service, Dr. Vu is a director of Healing Smiles, a West Australian not-for-profit charity which provides essential pro bono trauma-informed dental treatment to survivors of domestic violence. Jacinta's exceptional dedication to both her field and her community has earned significant honours, including being named the 2025 WA Local Hero as part of the Australian of the Year Awards and being a finalist for the Westfield Local Hero 2025 also. Furthermore, Jacinta holds fellowships in the Pierre Fauchard Academy, the Academy of Dentistry International and the International College of Dentistry, awarded for service to dentistry and the community. So thank you, Jacinta, for joining us. As I said, we'll jump straight into it, and I might ask you straight up, for anybody who might be wondering, what actually is trauma-informed dental care? What do we understand by that term?
So to me, I think trauma-informed dental care is care that we provide to patients with a lens of really looking at how they're presenting into us and looking at all of the whole context of the patient. So, we don't know when people walk into our clinic what they have going on in the background. They may have undisclosed trauma, anxiety, depression. Some of those things patients tell us about and some things patients don't. But I think we should assume that patients have a backstory. Everybody does. We all do. And it's coming at their treatment with being open to listening to them and to really creating a place of safety where they can relate with you, and so that you can truly get informed consent, and you're also empowering the patient as well and creating like a really trusted relationship where they can gain that sense of security and safety within that treatment. And you never know what your treatment is how it's going to impact their life in a positive way outside of the dental clinic as well.
Yeah, that's really interesting as well, that last bit you've said, and I hope we'll get a chance to explore that maybe later on. But first of all, maybe I'll get maybe a more narrow sense of what might that look like in dental practice. Say, for example, setup of the clinic, the mindset, and maybe training of the team and the dental professionals.
Yeah, I think it really involves everyone in the practice. From, the moment somebody calls up to make an appointment or turns up to greet reception, being treated with courtesy and respect is always a must, not just from a customer service perspective, but to set the tone of how you work in your practice with patients as well. Sometimes it's good, even when you're sending out paperwork like a medical history form, to even have simple questions asking, do you feel worried about your dental treatment? And there can be a list of questions that might look like, do you need a morning appointment or an afternoon appointment? Does waiting in the waiting room make you anxious? Would you like to bring someone with you? Do you have an aide that helps you to feel calm and relaxed? Or, what else can I do to make you feel more comfortable with me? So that, I think, is a good starting point. And then having staff trained to relate well to patients as well. And having an environment, I think, that is not too busy, but not too quiet. You think you need to get that right medium. And I think in this day and age, with lots of people have fidget toys. And so having some things like that available can make a big difference for some patients, because sometimes when you're communicating with someone, they don't want to look at you. But if they've got something busy to do with their hands, it actually makes them feel like a little bit more comfortable and they open up a little bit more. So those are some simple things. And before you even get into actual, talking to the patient more or dental treatment itself.
Yeah, reading into this previously, and some discussions I've seen almost relates this akin to universal cross-infection controls, where we implement protocols in our practice in terms of cross-infection controls where we're treating everybody like they've got a serious infectious contagious disease.
Yes.
And that's a broad brush approach for every patient in the practice. And it sounds almost like these principles could be adapted into practice almost the same way, because as you've said, a lot of these traumas and things that people have experienced, the majority of them are undisclosed. And we know from data that a significant amount of patients are carrying those burdens around when they doesn't practice, and we may not even know it.
That's right. I mean, I think the stats from a few studies have shown that 1 in 3 people have suffered an adverse childhood event, and that leads to trauma. And we don't know who that is, but it's a third of the population. That's a huge amount of people. So I agree. I think trauma-informed care, the more that I've sort of been involved in this space, should be something that we're doing all day, every day with every patient, and looking at everybody with that lens as well.
Yeah. And I suppose when we see the patients in our room and we get them into the chair, I went for my dental checkup and clean today, and I actually was thinking about this through this lens, because I knew we were going to have this conversation this afternoon. So I walked in, and the first thing you do is you have a bit of a chat, but you lie back flat in the chair, and you're lying in that prone and vulnerable position in the chair. And then there's that sense of a power imbalance, even though I didn't feel that myself as a fellow dentist, but I can see how there would be that sense of power imbalance, the professional and the patient, the knowledge difference. And that's, I suppose, the starting point of things we probably need to be aware of when we're treating everybody, but more so patients who've suffered trauma in the past.
Yeah. And I mean, even like, having a bib chain for some patients, having something around their neck can be a big thing. So asking, asking them, giving them the choice. And I think choice is one of the key words that we need to think about. Or you can still do dentistry, but you can give them choices that make them feel empowered. Do you want a bib chain, or do you just want it flat on your chest? What flavor of prophy paste do you want? What texture do you like? Are cotton rolls okay, or do you prefer something else? So there's lots of little things where those little choices can make such a big difference to how a patient feels, that they have some power, because they need to feel that they have the power in the relationship in the dental chair, and then that makes them feel more in control. And I bet, Colm, that you might have gone home, because I do this sometimes, and checked whether all of the calculus is off your teeth as well. We all do it.
I'm rubbing it with my tongue all day long. Yeah.
And I mean, that's our sense of control coming through.
Mm-hmm. Yeah.
We might not have suffered trauma ourselves, but we can use that. We know what that feels like to put ourselves in the place of that patient.
Yes.
And that's what it comes back to is, how would you feel? You have to really be able to imagine what it would feel like and walk in those patients' shoes to understand what things might, set them off or make them feel uncomfortable, and then try to change that narrative for them or with them.
Yes. Yeah. I think, as I said, that sense of immediately when you lie back in the chair, you could sense how that could make people feel very vulnerable and sense of powerlessness, and maybe it might trigger bad memories from, as you said, those adverse childhood events that might have happened to them.
Yeah.
So I think it is something we need to be very aware of, and also from reading into it, things that again we take for granted when you have a scale and clean, the taste of blood in your mouth, those things that you, and so those, I suppose we need to be very mindful that those things can be impactful or triggering or create anxiety or stress for patients who've had previous bad experiences.
I mean, even we had a patient who who spoke to us, and she had been sexually assaulted, and she said for her one of the triggers was the smell of the gloves, the latex, because of the context of the trauma that she had suffered. So there are so many different things. You know, the dental environment, because we live and breathe and work in there, it's not
Yes.
daunting for us. But for most of the population, it really is, whether you've had a trauma or not. But particularly for patients who suffered from FDV, it's someone touching your neck, someone behind you and kind of standing over you in that power kind of space and in your personal space, and in that, as you said, lying back, you don't have any control. And so that is very confronting for many patients as well.
Mhm.
Someone standing behind them and you not knowing where they are as well. So all of those things make a difference. You know, even just moving your chair around when you're talking to the patient, and so you can look at them more front on, can make such a difference to how people feel.
Absolutely, as much as possible. This may be a difficult question to answer, but I suppose speaking as a male, is there something to be considered maybe in that male-female dynamic, and maybe that male practitioners might need to be more sensitive or aware of this, that female patients may feel more vulnerable because of,
Yeah.
we know the majority of perpetrators are likely to have been male in these sorts of
Yes. And
incidents.
there is unfortunately such a high proportion of women in Australia who have been affected by intimate partner violence. I think the stats are something like 1 in 4 women over the age of 15 have been affected by intimate partner violence. So I think we do need to be mindful of that as well, and the physicality of some men, and they may not intend to be that way. It's just that's how they are. We do need to be mindful and understand that that can be quite confronting for patients as well. And I think part of what we do is really being aware of not just their patient's emotions, but our own as well.
Yes.
And sometimes I think we're getting potentially better at understanding emotions and being able to express emotions. And historically, it has been harder for males to be in that space than women. But I think as we grow in understanding, people who are able to, as a practitioner, still be vulnerable with your patient and let them in a little bit actually makes such a difference if they know that you understand some of what they're going through as well.
Yeah. Yeah. And I suppose that's part of that empathy thing as well, trying to understand and demonstrate to the patient that you understand, however you do that, by either saying or your actions, or however that may be, that you give that sense of empathy and that the patient is feeling heard and understood. And I suppose part of that would be listening when they want to speak to you as well without interrupting them. And maybe part of the other, I don't think it's necessarily a male thing, but if they bring problems to you, giving them that they are their problems, helping them find ways to help themselves rather than jumping in and trying to necessarily fix their problems. I don't know what you think about that.
I agree. I was actually literally going to say, as dentists, we fix it people all the
Yes.
time. We're always very much in, problem solving mode. I think it's the personality type that gets drawn to dentistry. But actually, what is more powerful for someone is when you're able to take that step back and let them come to the realization and find the solution. It's so much more empowering for that person as well. And that goes not just in dentistry, but that's in life generally as well.
Yes, that's true.
We're having a very philosophical conversation here.
Yeah, but it is, and maybe this might tie us back into what you said earlier, that if we enact aspects of this trauma-informed care, it not just helps the patient receive dental care, but it may help them in life in general. We may be given that first opportunity to demonstrate to the patient that they have autonomy and they can make decisions if we give them that capacity. Is that something you've seen?
We've had lots of patients who have had their dental treatment through Healing Smiles, and they've sent feedback back to us via email. For example, we had one patient who said that the dental treatment journey was very challenging for her. She had a lot of dental phobia, but because our volunteer clinician took so much time to make her feel comfortable, and she got through all of the treatment, and she said that it helped with her agoraphobia, it helped with her anxiety, and then furthermore, it really impacted positively on her mental health. So then she felt more able to go out and tackle other aspects of things she needed to. We have other patients, of course, who say, now I can smile again. I feel so happy that I can go and go for a job interview, or I can go to school pickup and smile and don't feel embarrassed. We take a smile so much for granted, like when you've got a nice
Yeah.
smile, nice
Yes.
teeth. And when someone tells you that and you really think about what the impact is, what that you've had, not just technically and clinically, but on that person as a whole, it's just that's why we're doing what we're doing, to see them come back and say, it's helped me in this way and this way and this way. That's just wonderful to hear.
Yeah, that must be ultimately so rewarding, not just doing the dentistry, but also having an impact in their overall life.
Yes.
Yeah, yeah. Now, you mentioned anxiety and anxiety management. Are there any particular strategies that fit in with this trauma-informed dental care in terms of managing what's we know is there in the general population anyway, dental anxiety and phobias, but maybe actually enhanced with a cohort of patients who've
I
previously
think
suffered
it's
trauma?
Yeah, I think, we've covered it's really about meeting the patient where they're at, being open, listening to them, and not only listening to the words, but really paying attention to their nonverbal language as well. Because, 80% of communication is nonverbal. So looking at what they're saying and what they're not saying, but their body language makes a big difference. And being acutely aware of that is important. I think we also need to remember that a trauma response doesn't always look like fight or flight. It can be freeze or fawn as well. And so patients don't always necessarily behave in a way that you think that they're traumatized or anxious, but they have these other responses where we need to be mindful of that as well. So if we're aware of those things and we are listening and open with our patient, then if they are able to let us know things that help them, then we can enact those things with them as well. And it might be simple as having someone with them that they're comfortable with, maybe a weighted blanket over them. That could be helpful for some people. Or again, like I said, a fidget toy could be helpful. The way you speak as well and the words that you use, the tone that you use can make such a difference. So even if something, goes slightly awry, not getting too worried, but being able to reassure the patient that, sometimes these things happen and we're going to do this to help it and we're going to follow this plan of action. And then, making sure that they're okay and that they understand that they consent to whatever's happening as well.
Yeah, yeah. No, that makes sense. And I'm guessing that something else, another emotion as well as anxiety that may come up in this space is also possibly a sense of shame and even a sense of blaming
Absolutely.
themselves for the situation.
Yeah.
How do you suggest, are there any particular strategies that you have in terms of dealing with that or helping patients through that as well?
I mean, I think that a lot of people do come and see me in oral med practice and they're like, oh, I got told off at the dentist for not
Yeah,
doing X, Y, and
yeah.
Z. And they feel sometimes they are trying as hard as they can, but they might not have, the right technique of brushing or flossing or interdental brushing.
Smoking
Yeah,
cessation probably is a big one where people feel a lot of shame
absolutely.
around.
Yeah, so I'm always trying to be open with them and say, we would like you to do this, but we understand that it's difficult. What can we do to help you to achieve that? Or maybe there's a different way that somebody could show you to do, your interdental brushing or something along those lines. And again, it's that really being non-judgmental, because you don't actually know what's going on in their life. There might be a reason that they're not able to do that. I had one patient who had really bad rheumatoid arthritis. And so she really struggled to even, with manual dexterity. So her oral hygiene wasn't the best. So even for me to say to her, I can really understand why, because you actually can't move your hand around, and I know you're trying your best, but maybe there are some other aids that might be useful for you. And I think that helped her to feel more understood. And
Yes.
then you can build that relationship, and then you might get a bit further along in, okay, well, we can do this and you can try this, instead of just going, oh, you're not brushing your teeth. And that
Yeah.
ends the conversation.
Yes. Yeah. And puts further shame on them by
Yes.
they think it's my fault. I'm not doing a good enough job. Yeah.
Mm.
Yeah. That's a really good example. And another question that may be running through dentists' minds if they're treating patients in this cohort might be that all of this is going to take a lot of extra time and work. And how do we get around that? Maybe building patients towards treatment really slowly, and maybe having a longer assessment, and maybe letting them attend a couple of times to get used to attending the practice before doing any treatment, or those sorts of things. What would you say to that?
I agree. It does take a lot of talking and a lot of reassuring and spending time. I think it was a quote, it was something along the line of, attention is one of the greatest services you can give someone. And so that really resonated with me, because I think it's really true. And I think if you spend the time with the patient initially and you build that relationship, they will keep coming back. Whereas if a patient doesn't feel heard, doesn't feel seen, doesn't feel understood, why would they come back? So if spending that time initially, yes, it will take you some time to be able to understand them, but the reward is that you're really helping someone, not just, again, from that technical expertise,
Yes.
really helping them as a whole person, which is, I think, why we're all in dentistry anyway, or hopefully.
Yeah. Yeah. And I think that's a really good example then again of applying it universally in your practice.
Yes.
It is as long as it takes to build a rapport, to build trust, to ensure that the patient feels heard and understood and has a sense of maybe power or control, as much as that can be possible.
Yeah. Certainly within Healing Smiles as well, there are patients who can't even step into the dental clinic room. And so our volunteer clinicians very understanding of that. And so they'll sit with them somewhere outside of the dental chair itself, for example, in the waiting room, at least for one, maybe even two sessions, just to kind of see how they go, and then gradually just get them to come into the room. It's almost like a desensitizing
Yeah.
type of procedure in a way, so that the patient then feels, okay, I can do this. And then I think by giving them that sense of empowerment, they get the confidence. And once they have the confidence, then they're happy to have the treatment done, giving them the choice of, okay, we can do this tooth here or this tooth, or we can do a scale and clean, or how many things do you want to have done today? Again, they're all those little choices that make such a difference
Yeah.
for a patient.
Yeah. Yeah. And you did mention screening in terms of, I suppose, treating trauma affected patients. So is there a particular tool that you use, or is there something that you recommend maybe people in general practice could use or should use or might be helpful in certain situations?
There is. So it's called a SARC, Sensitive Practice Request Form. So there are some publicly available ones, mostly from the Department of Health in WA. Definitely have them. So you can have a look at those and borrow those. And they go through a list of questions, which are specifically tailored to help you determine, what you need to do to make a patient feel more comfortable. So I think that's a really good starting point when, if you're wanting to implement some of these things into your practice. I think that's a really good one. And, sometimes even just sending the form out and someone knowing that you're thinking about these things makes a difference to that patient as well. They may choose not to fill it in, but that's okay. You've made the effort to meet them somewhere as well.
Yep. And you may be the first health practitioner of any form that's ever given the patient the opportunity to tell you something
Yes.
and that they may have ever encountered. So that might be very even empowering to start off treatment. And what about if a patient does disclose something to you as part of your just routine dental care, say, for example, something about, I suppose, an area you know quite well, domestic violence, or perhaps some form of abuse, like physical abuse or sexual abuse. I don't think we're necessarily very well prepared or equipped to deal with how to respond to that. Have you any
So,
thoughts about that?
yeah, so I think in the first instance, remain calm. That's always my number one. That's what I tell patients a lot. I'm like, number one rule, remain calm. And then be curious. So you can ask them, I think the first question I would ask is, are you safe? And is there anything I can do to help? Some patients may disclose, but they're not in the position to leave the relationship yet because it's not safe. And at that time of patients or people leaving a FDV relationship, that's actually the most dangerous. So you don't want to just pick up the phone and call the police without consulting with the patient to see where they're at, whether they need that help or not. It's about being able to be calm, be considerate, be curious, find out if they're safe, find out if they need assistance or help, and then providing some contacts potentially of, for example, Lifeline or White Ribbon, those sorts of organisations where they can get further actual help from those organisations, which we're not qualified to give, and that's okay. But that is what we can do. And I think the other thing that we should be doing is if we see something in the mouth that we think might indicate these sorts of things, documenting it is actually okay to do as well, because that then if the patient comes back and they've got a court case or something going on where there's an investigation, having that recorded by a health professional is actually really important.
Yeah. Okay. Or maybe even signs of assault or something around the
Yes.
face. Yeah.
And it, not necessarily just the physical things, but, you know, if they come with their partner and the partner seems to be running the show and telling you the patient's story instead of the patient themselves, is there an element of coercive control? Is there financial abuse? If they're excessively anxious, those can all be signs of family and domestic violence as well.
Yeah. And it is a question we do get asked from time to time on the phones at Dental Protection around, is there an obligation to report this? And I suppose I know from looking into it from time to time, there are different state by state
Yeah.
requirements and thresholds. I don't know if you've got any general comment on that. It is probably a trickier one to answer.
Yeah, I think there are state specific rules. I don't think there's anything specific, like, I don't think we're mandated in WA
Mm-hmm.
for, to report. So it does, but I think, yeah, you have to refer to your own state
Yeah.
kind of rules.
Yeah. And it's possibly something, you can ring your indemnifier and maybe get some
Yeah.
guidance, because
Yeah.
we cover across Australia, and I know
Yes.
it is state by state. There are different rules. Yeah, tying everything together in terms of the trauma informed dental care. Is there anything further that you think is relevant for our members in terms of maybe seeing those patients or applying that universally, maybe as part of just a call to action, maybe to practitioners to maybe think about this and apply on a more universal level in their practices?
Yeah, I think we can all do it. And I think we should be all doing it for every patient. And this is the true meaning of healing. We're healthcare workers. Heal is in our name. Why are we not thinking about people as a whole? We're not just here to tinker with teeth. We're
Yes.
actually here to help a whole person.
Yes.
So I think we should be, yes, I think that it should be universal. A slight mindset shift for some people, but I think most of us do elements of trauma informed care every single day. Otherwise, we wouldn't have a patient come back to
Yes.
us. So we do a lot of things very well, but we can make tweaks to make it even better.
Yeah, I agree with you. It's something that we unconsciously, I think, do very well, is because we deal with anxiety pretty much all day, every day. There's very few chilled, relaxed patients that just come in, lie there, have the treatment and walk out with any degree of anxiety. So we're very whether we consciously know it or not, very good at dealing with, I suppose, picking up signals and cues from patients, being empathic, hopefully listening well, and hopefully giving patients some degree of power and autonomy, even if it's what we do. We all do every day even when we're doing a scale and clean, we tell the patient, put your hand up if you want to stop at any point. I mean, that's giving the patient some degree of autonomy in the procedure, that they've got a degree of control. So yeah, if we can extend that a little bit further, or just bring it more front of mind, I think it would be a really useful thing to think about. Yeah.
Definitely.
And the other thing that you said as well, that the positive impact of enacting this, not just from the dental perspective, but also for the whole person perspective, I think is really inspiring, and really it must be very rewarding when you see that in your work with Healing Smiles.
Yes. I mean, not just Healing Smiles, but
Yeah.
even in oral med practice as
Yes.
well. I mean,
Yeah.
as you can imagine, most of my time is spent talking with patients as well. So I don't find it a stretch to think of it as a separate category. Trauma informed care is not separate, it's an integral part of what we're doing.
Yeah. Yeah. And can we talk a little bit about Healing Smiles, something that I know is
Yes.
very dear to your heart and you're very passionate about? Can you give me a little bit of a background of how it came about?
So Healing Smiles began in 2018. It was actually started out of the Women in Dentistry Society, and Dr. Goshabali, one of the orthodontists in Perth, she was the outgoing president, and she said, we're raising funds for various charities, but I'm pretty sure we can do something that really directly helps people, because we have so much expertise amongst us, women dental practitioners in Perth. And so she thought about it for a little bit, and she said, I've got it. Because family and domestic violence was really topical, she said, why don't we do this? And so we were all very, I think I was the incoming president at the time, so we were all on the executive committee very supportive. And so she got it up and running. And so that was 2018. And it started off with just a small group of dentists who got together and said, okay, we can do this. And we spoke a lot to the Australian Dental Health Foundation to kind of get an idea of how to kind of get the ball rolling. And then we started seeing patients in our own in practices, essentially. So it's almost a little bit like adopt a patient from the ADHF model with Rebuilding Smiles, but it's actually a step beyond that, because not only do we have a group of general dentists, we have almost every dental specialist represented in our group of volunteers. And so we can refer patients in-house essentially, to, for example, if they have a challenging endo, we can refer that on to the endodontist who's a Healing Smiles volunteer, or someone who needs a difficult extraction, we can refer to our MaxFax surgeon volunteer. And so that makes it a really powerful kind of thing. And then we do talk as well between ourselves sometimes about patient management and how to kind of navigate certain things. So there's that collegiality aspect as well. So in 2020, I was asked to step in then as the clinical coordinator of Healing Smiles. And that was kind of a time when I wasn't working as much. So I had some time on my hands, and I was like, okay. Then we had to navigate the pandemic,
Yeah.
which was hugely stressful because nobody could do anything. There was more family and domestic violence incidents, and so our waiting list was getting bigger and bigger, and our amount of patients being seen was getting smaller. Luckily, 2021, and the Oral Health Centre partnered with us and said, you can come and use our clinical space. So then we were able to start getting some more patients through. And then as the new normal for dentistry happened, then patients were being seen in private practice as well. Then from there, so we've had a massive few years. From there, we had the attention of the Department of Communities from a small grant that we were awarded in 2020. And then after the state election in 2021, they called me and said, we've got money for dental treatment for women survivors of domestic violence. What should we do with it? Shall we give them vouchers? And I said, well, no. What you could do is, we need a clinic. Can we build a clinic, because we're doing this work, so we can actually facilitate a practice that is built from the ground up with trauma-informed care essentially in mind, And so they came back to me after a week and they said, yes, we can have the money. So
Oh,
fast
okay.
forward to January 2025, and we've now opened our 2-chair clinic
Yeah.
of our
Congratulations.
own.
That's
Yeah,
amazing.
which has been incredible. And so since 2018 to now, we've helped over 600 women and probably provided at least $900,000 worth of free dental treatment in that time as well. And it's not about the numbers though, it's about those, each individual life that we've touched. We hope that we've made a positive impact. We hope that we're playing our part in breaking the cycle of family and domestic violence as well. And we know that, when mothers feel good, they pass that on to their children. So we're hoping that intergenerational kind of thing also, improves as well.
That's amazing. You must be so proud of everything.
I am. The whole team. The whole team is amazing. Our volunteers are very kind, very generous, and they're the heart and soul of, Healing Smiles. And I've been awarded certain things, but it's really just a representation of what they're all doing. So I don't get to do so much of the clinical work because there's not as much need for oral medicine as general dentistry. So I give my time in a different way on the back end of things, essentially. But it's nice to have that recognition for our volunteers and for the work that we're doing.
Yeah, absolutely, absolutely. It's really wonderful, and I suppose the positive publicity that you've got not just in the dental community but in the broader community and raising awareness can only be beneficial for everybody, the whole community. So yeah,
Yeah.
congratulations.
Thank you.
I also just wanted to ask you a little bit, just to bookend the conversation about volunteering in general. It's something I've done from time to time over my years as a practitioner, and I know that the profession as a whole does a lot of volunteering as as a dental profession, and it's something we don't necessarily get the recognition for or the publicity for. So that's one thing, I suppose. That's just a comment. But the other thing is for younger practitioners, if they're thinking about volunteering, what would you say to them in terms of I suppose, the benefits to the community, but also what they might learn or how they might learn and grow themselves through the process of volunteering?
So I think, to make a positive impact on the world can see a need, but you can't just see the need. You actually have to do something about it and take action. So taking action is one of the things that volunteers are doing. So being able to enact that, I think, is number one. And the second thing is if everybody did a kind act, imagine how much better the world would be. And every person who takes that step shows other people that you can have a positive effect. And so I think then you actually get like a wider kind of net. So I
Yeah, a
really do
ripple
encourage
effect.
people. Yeah. So I do encourage people to think about volunteering. We're very fortunate as dentists. We're actually in a very affluent career. And if we can make a little bit of time to give back to our community, we can see the positive impacts we have on them, but you also feel that come back to you as well. There's something about helping someone else and seeing it might be something small, but you don't know what that small thing means. Even just smiling at someone could be the difference between them making a certain choice.
Yes.
So, I think about those things, periodically as well. And I think, and again, another context would be it takes at least 7 attempts on average for a woman to leave a domestic violence relationship. How do you know where you are in that number if you haven't asked? And so that's very specific to what we're doing. But as a principle, we don't know how much that small thing that is kind means to someone else. And I think that's what I would say to people is if you have time and you have the ability, why not use that ability to give back?
Yeah. Yeah. And particularly as dental professionals, we have such a unique and specialized ability, and it can be so transformative to help somebody with our unique
Yeah.
set of skills. Yeah. Yeah.
And for me as well, I want to be a role model for my children as well. and show them that, it's not always just about you and what you're doing, but you need to have that wider perspective. And we are a community together, and we need to function within that community, and we should be helping each other as well.
Yeah. Yeah. I think that is a really lovely place to leave this conversation, Jacinta, on a very impactful note like that. So I really want to thank you this evening for giving up your time straight after practice. I know you've had a busy day, so we're really grateful and appreciative for your time and for this really wonderful conversation. So thank you for that helpful content, and thank you all for listening. We hope that this podcast was helpful to you and look forward to sharing more guidance with you in the future. If you like Dental Protection podcasts and would like to hear more, please subscribe and leave a review.